Here's the public health impact: compromised quantity and quality of drinking water, increased recreational risks, poorer air quality, poorer sanitation and hygiene, compromised nutrition, and increased incidence of illness and disease. Let's unpack this. The root of it all is when water levels are low, there's an increased amount of concentrated sewage and pollutants.
The raw water that goes into any purification works will be of far poorer quality during a drought. The quality of the river water has deteriorated sharply over the last few years, and particularly in the last year.
If you or anyone you know has had a runny tummy recently, blame it on the drought. Barnes says there could be far more gastro cases if there's no rain. There's been a spike in diarrhea cases amongst children living in informal settlements who don't have access to clean, fresh water. If you don't wash your fruit and veg properly, you're ingesting raw river water.
The water that's used to irrigate those vegetables come back to you on your table.
And be careful when buying fish. Low levels of water in rivers, lakes and commercial fish farms can increase levels of pathogens and parasites that end up in the fish and ultimately on your plate. Wading or splashing in water running down the street, dams or rivers can cause eye, ear and respiratory infections if it touches the face.
Children play in water running down the sidewalk and build mud houses. When something splashes on your lip, or when you breathe in some of the droplets as you splash, that is a pathway to your respiratory system.
The greener or bluer the water's hue, the more dangerous it is.
If there's too much sewage present in that water, then these organisms will multiply, and even dam water can present us with microorganisms, blue-green algae that produce toxins.
These toxins affect the liver, heart, kidneys and gastrointestinal tract. Warning symptoms are vomiting, diarrhea, skin and throat irritation. Less water means poorer sanitation.
People are cutting down now on home hygiene, so they're not cleaning as much.
But it's not just individuals who are affected. In areas with severe water shortages, hospitals are at particular risk. Bed linen can't be washed, theatre floors can't be cleaned, and staff are unable to wash their hands, so the spread of deadly hospital-acquired infections increases. As for air quality, during a drought, there's an increased risk of wildfires and dust storms. The dry, dusty air irritates the bronchial passages, increasing the risk for bronchitis and pneumonia. With the drought pushing food prices way up, it compromises the nutrition of those who cannot afford to buy basic food items, weakening their immune systems and affecting their health. And of course, not having enough or safe drinking water causes dehydration. Barnes says at present, people in smaller municipalities are more affected than those in cities. Bibi-aisha, Cape Town.